You know, I thank you very much for your introduction, and being able to be here and see who's here, and to feel really why you're here, to meet Jubin and hear about the background for this gathering, and to think about the challenges we all face in the future as we try to change our healthcare system and the role that you could play in that. It's just very invigorating. I'm going to, first I want to associate myself with really all the comments that have been made by Dr. Pomeroy and Dr. Kirsch regarding what's going on, the type of changes we need in the practice of medicine, in the education of physicians and other health professionals, and also in the way we run healthcare in this country in general. But I want to key on a couple other items first. Jubin mentioned that I trained in family medicine, which I did. I spent 11 years as Dean of the Osteopathic Medical School in Maine prior to doing this current position. One thing I learned there was that medical schools are very hard to make changes in sometimes. And one of the best ways to make changes is to try to get the students excited, to try to get the students asking the faculty, why can't we do it this way or that way? And so in my mind, those who will be students, those who become students, can really play a major role in driving the kind of changes we need in our educational system as well as in our healthcare system. And I look forward to you all to be participating in that. One other observation before I get started, and I'm going to go through this pretty quickly, is that I trained also in preventive medicine, which is really a public health degree. And there's really a tremendous overlap between medicine and public health, and there needs to be more of an overlap. Certainly those of you who are going into public health and those of you who are going into medicine will recognize that as you go forward, that you need to look at both the forest and the trees, the patients and the community, and that the more you can think in both terms, the better off you will be and the better off our healthcare system will be as well. And so I encourage you to, it's great to see AMSA being able to sponsor an event like this that includes both pre-med and other health professionals and public health. And I say that as a former chair of an AMSA chapter back when I was in medical school. Quickly, the AACOM, as was mentioned, represents the now 26 colleges of osteopathic medicine in the U.S. with our bottom line mission to improve the health of the American public. Here are where our schools are located. Many of them, 9 of them, have been established since the year 2000. And we are present in really with 26 schools, 33 campuses, if you count the branch campuses and other locations, in 33 states. We are facing, as you well know, many issues that have been alluded to in our previous talks. And I'm not going to go through all these. You can look at the list and think about it. The issues seem to be overwhelming in a lot of ways. But we're also at a time where changes can be dramatically made. And it seems to me that a lot of the changes that will be made will be driven, as I mentioned earlier, by the folks in this audience. The population is changing, as Dr. Kirsch mentioned. Sometime in the 2040s, the majority of this population will be non-white in this country. Our medical schools, both osteopathic schools and allopathic schools, and the other health professions for that matter, could be doing a hell of a lot better than we are doing in terms of thinking about the type of professionals that we need to be training, the type of diversity we need in our student body, in our faculty body, et cetera, to really do an adequate and an appropriate job of taking care of the populations that should be looking at people who look like them when they go for their health care. But we're also in this situation where right now we don't really have a healthcare system. We have this growing numbers of uninsured. We lack the diversity, as I mentioned. In Maine, I was from a rural state, and the incredible difficulty of providing health care in many areas of Maine that were rural are played out not only in rural areas, but in many urban areas as well. So things are not distributed well in this country. And as Dr. Kirsch mentioned, the healthcare shortages are real in terms of physicians and other health professionals. And it's not, and the reality is that in and of itself is going to force changes in how we do take care of the population going forward. We're going to have to rethink how we deliver care because there just won't be enough of us to do what needs to be done, especially if you throw in all those other factors, chronic disease epidemic, the aging of the population, et cetera, that's going on. Healthcare reform, hopefully, will move towards universal access, will be patient-focused, will focus on team-based care where people will be working at the top of their license, where there will be true diversity in the health professions themselves, where prevention will be prioritized, where primary care will be a basis for our healthcare system, and where maximum use of information technology will occur. There's a big distance from where we are now to this. But the reality is, there's a real chance that you will see that transition occur, especially if you go into this with that vision in mind. There have been a lot of recommendations regarding changes in medical education, many of which are currently being implemented. Dr. Kirsch mentioned some of them earlier. Medical schools, I'll just read a few. Medical schools should give greater priority to teaching. The admissions process should broaden the definition of merit and downgrade the importance of standardized tests and GPAs. Accelerate the efforts to reassess and update the MCAT. Align the medical school mission with the healthcare needs of society with a renewed focus on primary care. These things are happening. It's a big deal to make these kind of changes in the kind of institutions that currently exist in medical education, but it is occurring. For tomorrow's physicians, in my mind, we need to diversify the individuals admitted to medical school, not only by race and ethnic background, color and gender, but in a variety of other areas as well, where science and math grades alone do not determine admission, where people can lead but also be team players. They have both skills and analytic skills, but also people skills, communication skills, and come with a mindset where they can engage and recognize their role in the community as well as within their clinic and within their individual patients. So again, I'll say it, today and tomorrow students will help transform our healthcare system, so think about that as you look forward. I'm going to spend a few minutes just talking about osteopathic medicine because that's what I know. I am an osteopathic physician, and I represent the colleges. And there are DOs, doctors of osteopathic medicine, all around the country. About a tremendous amount of growth in the last 20 years, about 60,000 DOs right now, 2/3 of which are in primary care specialties at this time, but that is changing, as I'll speak a little bit. About 7% of DOs or physicians in the U.S. are osteopathic physicians, about 15% in the military, doing 100 million patient visits a year. DO, Doctor of Osteopathic Medicine, fully licensed for full scope of practice in the United States and in over 50 countries worldwide, training and practicing in all specialties with the same rights, privileges, income as other physicians in this country. Our growth has been significant. Just 40 years ago, there were 5 osteopathic colleges, and now there are 26. What's the difference, if any, between allopathic and osteopathic school? Well, we both have a 4-year medical school curriculum. People come into school after undergraduate training, sometimes with higher level degrees even by that time. They do their basic science and clinical training. They graduate. They have to do residency training in order to go into their specialty. do the licensing exams, either USMLE or COMLEX, to get through school, through residency, and to get licensed, and then begin to practice. Now, all of the things that Dr. Kirsch mentioned in terms of the type of changes in this continuum are happening and may begin to have some kind of impact on this. The osteopathic medical school curriculum pretty much parallels the allopathic in basic science and clinicals, with third years typically doing their clinical rotations in surgery, internal medicine, pediatrics, obstetrics, gynecology, emergency medicine, family medicine, psychiatry. In addition, though, one of the differences is that osteopathic students have courses in manipulative medicine and osteopathic principles in practice, which are classroom and laboratory-based courses in the first 2 years, and then are integrated into clinical education in the third and fourth year. So, to the extent there are differences, they tend to be focused on hands-on touch, using your hands to diagnose and treat certain symptoms that your patients present with. Our admissions process has a little bit of difference in that it is a rolling admissions process versus an annual decision-making process. Our schools have a primary care base from both an historical and philosophical perspective, as well as from the belief that no matter what specialty you might want to go into, that being trained from a primary care perspective first will make you a better specialist. But many of the type of things I write here, patient-centered, early patient interaction, community-based clinical education, occur in allopathic as well as osteopathic schools. It depends on which schools you're looking at. So what I would urge you to do is think, if you want to become a physician, look at your options. Look at your options and make a decision on what's going to be best for you. And really, the three ways to do it in this country: one is to go to one of the MD schools in this country, one is to go to one of the osteopathic schools in this country, one is to leave the country, go to school, and come back in and do residency training here. We have other schools in the process of being developed as well. A new school just was approved in Mississippi. One is being developed in Alabama by the Alabama Medical Education Consortium, we think. And Western University is looking at starting an additional location outside of Corvallis, Oregon. And the Edward Via Virginia School is looking at a location in Spartansburg, South Carolina for a branch campus. So there is a continued growth occurring. There are 20 private osteopathic medical schools and 6 publics, which I won't go through this. You can obviously find this information as you wish on the website. But I do want to talk a little bit about our application process, which is known as AACOM. And those of you who apply to osteopathic school will fill out one of these applications. We've been growing tremendously, as you can see, in the last 7 years, with 7, 8, sometimes 12, 15% growth in number of applications year to year. Right now, for the 2010 cycle, we're up about 7% over where we were in 2009, which ends up being about 2.5 applications for every seat. Now, a number of our students, in fact, the majority of our students are also applying to allopathic schools as well. So there's a very mixed group of people applying to the MD schools in this country and the DO schools in this country. Now, California, the schools in California represent a significant number of the applications of people that want to go to osteopathic school. If you look at this chart, and hopefully you can see it, you can see that UC Davis there is in the top 20 of schools that apply, that have applicants to the AMCAS, to the AACOM system. And there's a total of 6 of the top 20 are there. And if you look at those who matriculate, UC Davis is number 6, with 62 matriculants in 2008 coming from the UC Davis system. California really is a significant supplier with about, for 2008, 480 of the matriculants into osteopathic schools coming from California. And you can see what it looks like for the rest of the West there. How about our issues with GPAs and MCATs? Well, the overall MCAT, this is the timeline you can see, is now 3.46 average. And for MCATs, these are the verbal, physical, and biological broken down over time. But the average MCAT now, mean MCAT is 26.12. Again, mean, which means there's folks higher, folks lower. It depends on where you are in terms of the schools and the individual experience. And I encourage you, if you want to explore osteopathic medicine as a pathway to becoming a physician, to talk to the schools and especially some of the people who are going to be here. We have in 2008, 4,700 plus matriculants, of which 48% were women. 75% were sort of traditional age students, with 20% in their 20s, up to 30, and 5% over 30. I was 32 when I started, and there is always a significant opportunity for second career individuals, for those who've taken a different pathway to explore osteopathic medicine. It can be a challenge because as you're older, you may have different situations with your life and family and things like that. But there is no way that should inhibit the opportunity to think about a career in medicine and in osteopathic medicine. Our total enrollment now is a little over 17,000, of which 49% are women. Only 8% right now are underrepresented minorities. This is not acceptable to our schools, and it's not acceptable to me, and it's not acceptable to our society, and this is something that we very much are trying to work on. One difference now compared to 10, 15 years ago is that more and more of our students desire community and especially international type of service, so that many of our schools have opportunities for students to do clinical rotations. Sometimes they have clinics and other types of experiences in other countries, or enable opportunities through electives and that type of thing during their clinical years to do that. We have many students interested in dual degrees, and many of our schools offer opportunities for things like a dual degree with an MPH, an MBA, PhD, even a JD or others. More want to be employed rather than self-employed, not leave the old pattern of opening up your shop or going into a small private practice with a group and become a part of a system that's working with others in more of a team-based care with other physicians as well as with the capabilities the system provides to provide care. And I mentioned that more interested in non-primary care specialties. About 40–50% of our graduates are still going into primary care specialties when they're completed, but many are going elsewhere as well. And there's lots of reasons for that. That's worth another whole topic. There's whole meetings to discuss the primary care crisis that we're experiencing. And I personally think that there will always be a role there needs to always be a role for physicians as key components of the medical home that we need to develop for the health care of our countries. So, is becoming a physician in your future? I just conclude by saying this is an exciting time to choose to become a physician for a lot of the reasons I mentioned, because you can be part of the solution. You can help drive the change. Today and tomorrow, students will help transform our healthcare system, and you should be thinking about whether an osteopathic medical education might be the path that you wish to follow. So with that, thank you very much. And I apologize, I have to leave to go to the airport, so there are a number of folks here from our schools and sessions on osteopathic medicine, so to the extent you want to find out more about it, please take advantage of that, and there's our website address if you need to. Thank you.